Healthy gums are firm and pale pink. They don't bleed when you brush or floss your teeth. But if bacteria sits on your teeth for over 24 hours, it can irritate your gums and cause inflammation, bleeding, and redness. This is known as gingivitis. Gingivitis is a reversible condition, which means that through improved home care and seeing a dental hygienist on a regular basis, your gums can return to health. But it is really important to brush your teeth twice a day, ideally with an electric toothbrush, and use floss or interdental brushes to get between your teeth where your toothbrush can't reach. If plaque sits on your teeth for a prolonged amount of time, it sticks to your teeth above and below the gum line, and this can cause permanent destruction of the periodontal bone that your teeth sit in. So this irreversible process is known as periodontal disease. Everybody is susceptible to periodontal disease, but there are risk factors such as smoking, uncontrolled diabetes, and stress that can increase a person's likelihood of getting it. Crowded teeth, dysfunctional bite, and poor restorations can make it easier for plaque to stick to your teeth and harder to clean your teeth effectively. However, restorative and orthodontic treatment that we provide at Pond Square Dental Practice can address these issues. Poor oral health doesn't just affect your mouth. There is overwhelming evidence that suggests the bacteria that causes gum disease is also linked to diabetes, heart disease, and Alzheimer's. The telltale signs of having gum disease is inflamed, sore, red gums, especially when you floss or try and use interdental brushes, or even when you brush your teeth. If periodontal disease continues for a long period of time, it can result in tooth mobility, in extreme cases, tooth loss. So every time you come in for a dental hygiene appointment, at the start of the appointment, the dental professional will assess your gums and compare the bleeding score and plaque score and how much inflammation is in your mouth compared to the appointment before. Dental professionals assess a patient's periodontal status and risk through interpretation of radiographs, medical history, and physical examination of the gums. In combination, these factors indicate a treatment plan for an individual patient. All of our patients at Pond Square Dental Practice get advice on home care, so that's brushing technique and using interdental brushes and floss, as well as a recommended recall to come in to see the hygienist for professional plaque removal. So our low-risk periodontal patients, we advise to come in every 6 months for routine hygiene appointments. However, patients at higher risk for periodontal disease, we might recommend them coming in 1 to 3 months for a deeper hygiene clean under local anaesthetic or to see a periodontal specialist. Periodontal disease is irreversible. However, we can stabilise it through optimal home care and regular visits to a dental hygienist or periodontal specialist. Healthy gums aren't painful to treat. It's not invasive and everything's healthy, so it's not intense when you come in. However, if you have got gum disease, it is an active infection that's going on in your mouth. So it's like having a wound on your hand and somebody prodding and poking it. It is going to bleed, it's going to hurt, it's going to be sore, and it might be sore for a few days afterwards. But to help patients with pain management during the hygiene process, we can deliver local anaesthetic to certain areas of the mouth to give patients a pain-free experience. If you do have any concerns about your teeth or your gums, definitely go and see a dental hygienist or your general dental practitioner to have a checkup and see what's going on, because the longer you leave it, the worse it's going to get.